Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers and do not represent an offer to buy or sell any securities. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And it must be Friday. And indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're podcasting now, so you can pull our show down on all those podcasting apps that are out there. Make sure you like us, you review us, and please recommend us. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. And how do they do that? They do that by listening here, not to me, but to these extraordinary guests that I get to come to the show. And today's no different. I've had this guest on repeatedly. She specializes in the area of cardiology, and it's really, really exciting to have Lindsay Thompson back in the house. She's Vice President of Operations for a group called Cardio Management Services. Welcome back.
Hi, happy to be here.
Hold on, we have a little mic situation here. Go ahead, keep talking.
Hello.
All right, we don't have that. Let's see if we can grab this mic over here.
We'll try to switch.
No, that one's not working either. Maybe we'll try that one over there, Lindsay.
Music
Thank you for
here.
being patient.
Is this one working?
Oh wow, that is music to my ears.
Okay, let me switch.
There you go. We're gonna play a little musical chairs here, and we're gonna get her situated. But you know, Lindsay, she used to work in a fantastic hospital called Honor Health, and we had her here when she was with Honor Health, and she was in the cardiology field for them for a few years. I mean, yeah, how many years were you over there at Honor Health?
I was there for 22 years.
I was going to say 20 years, but I mean, I don't understand how you could be there 22 years because you're like 20 years old.
Thanks, Bob. I appreciate that. Appreciate that much more now as I'm heading. I'm in my last year of my 30s officially now. So
well, enjoy it, and I will tell you, someone that is now encroaching on 62 next month. You know, I just tell people make those moments matter, and that's really cool. I mean, you've got two kids you were sharing with me, and they're, you know, elementary school. I don't know if you have one in middle school yet.
No, I'm not looking forward to that.
Yeah.
No, they just started a few weeks ago. Well, we're in week 2 now, week 3, first and third grade. So we're quite busy with that, but it's been a fun ride so far. I'm sure I'll change my tune here when my daughter turns 12, because I remember when I was like at 12, I probably my parents wanted to orphan me at one point, I think so.
Well, I got a chance to meet with your mom,
Yeah.
and you guys both were here on the show together. She's amazing, and she's probably just kind of looking, and she can't wait for that to happen and say, you know what?
Yeah.
Karma, baby.
I know.
Karma.
There are definitely times where I'm like, man, I am really sorry that I did that.
Well, you didn't know,
No.
or should I say, you had the demons. You needed to go through an exorcist, and you did. I mean, look, I'm a father of 3 daughters, and they do come back. It's amazing. I have a wedding in 2 weeks.
Yeah, that's what you were saying.
Yeah.
That's exciting.
It is. I mean, I had my first one last November, and I've got this one coming up on September 1st, and And my baby, who's a labor and delivery nurse over at Cedars-Sinai, just last month got engaged. So we're probably going to have one in 2025 as well.
Look at you running up on those weddings.
Yeah, going to knock them out. And you know what happens after that?
Then you get those grandkids.
That's right. That's right.
Yeah.
I'm not in a hurry, but I think I would like that because I have a lot of friends that are doing that.
Yeah,
And
it's fun. I feel like it makes you, I always say, your parents, they love you, right? But when you have grandkids, they like you, but really they could care less if the grandkids are around. So, which is fine. Then they deserve that, and they should have that whole time with them. And I'm grateful that my parents are able to be involved in my kids' lives, and they're young enough to experience that and have fun with it. So
love hearing that.
Yeah.
So Lindsay, cardiology is your specialty. 22 years, I think you said, over at Honor Health.
Yeah. And
now you're with this group. I use the acronym CMS, but people think of that as Centers of Medicare or Medicaid Services, but that's not what we're talking about here. We're talking about cardio management service. So, please share with us a little bit about your company, as I know you did share this with us last year when you were on. But I want to start with that.
Yeah. So we are, I work for, it's called a MSO, or a management services organization. We work alongside we're private equity backed. I think that's, that is a buzzword right now in healthcare. Right. And it's something that, when I first heard this coming into the market, several years ago, working for a not-for-profit healthcare company, it was very foreign, but it was also, we were on the defense against it, right? Because you knew that they have funds to kind of combat things that others don't right now in the healthcare world.
Mm-hmm. Especially when you're not-for-profit.
Yeah. And so what I slowly learned, when I was still working for the hospital system, that this is kind of the way that things are leaning, in particularly in cardiology. And the reasons why are because cost of care has gotten out of control. B, to combat those things, you're seeing a lot of things be transitioned out of a hospital and into kind of these ambulatory settings. You've seen it happen with orthopedics, right? People aren't really getting knee replacements done in a hospital anymore. They're going to a surgery center. This keeps the cost of care down for payers, for everyone, for patients is what it really impacts. And you're seeing a lot of the cardiovascular things be moved in that direction. If you would have asked me, even 5 years ago, if I thought that was a great idea, I would have said probably not. Right. Now, the advances in just the therapies available for patients, coinciding with the ability to do those in that ambulatory setting, I think it is the right move. And you're seeing hospitals get on board with that, right? You're seeing many of the hospitals here in the Valley as well get on board with building those ambulatory centers, because they're seeing this is where the shift is. It's more efficient. It's less costly, cost of care of that, and cost of just everything in general for that, down to your supplies, what those devices cost. And it allows, patients to get even more timely access to care. Most of the time in the hospitals, they're not able to kind of turn and burn those cases in a very efficient way. Whereas in an ambulatory surgery center, a provider can do double the volume that they do in a hospital, just because they're able to make it more efficient. And I think that part in general, right, it cuts down on the time patients are waiting for care, waiting for those procedures. And so I think that's where, we're hanging out at right now. We come into practices. We have a large practice in Las Vegas, and they have a recent acquisition here in the Phoenix area, and we're working on several other markets at this point, where we come in, work alongside with those physicians. We're physician-owned, physician-led, very similar environment that I came from at Honor Health, where we really work to strive to have clinical leaders leading the way. And we're doing the same thing with our MSO now. So I think that's a little bit different than some of the other MSO platforms out there that may not always be physician-led, but we're doing it that way. So,
the concept about being able to be in an MSO, I mean, the stereotype of physicians are they're usually not very good business people.
Yes.
And in a lot of cases that is the case.
Yes.
So
well, it's hard. It's hard for them, right? Because you forget that managing a business is a full-time job, but they're also doctors too. So not only are they trying to see patients and take care of those patients every day, do those procedures, they're also human. They have a human side too. They have a wife, they have a family, they have a husband, they have kids, they've got all these things. And then they have to still see all those patients and manage that business. Not only are they doing that and managing that business, a lot of times for these guys means they are trying to be the accountant. They're trying to be the HR person. They're trying to figure out technology, and it's really just not sustainable.
100%. You hear the music.
Yep.
I know you've been on before,
Yep.
so we down one, we got 3 more to go, but I do want to pick up a little bit on what you just said, because the hardest thing for doctors is obviously patient care is number one. But if they're trying to run the business, I mean, you've got all of those pieces and parts. You're talking about cash flow, you're talking about HR, because you're employing all these people,
Yeah.
and you want to make sure you stay in compliance. So there's so many pieces to that puzzle that you, as an MSO, get to solve.
Yep.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Lindsay Thompson in the house. Great to have you back. You're going to be around for 3 more segments.
We will.
Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here. And if you missed our first segment, I've got Lindsay Thompson here with me. She's with the Cardio Management Services Group. They're an MSO, a management service organization funded by private equity. If you missed our first segment, go out to our website at cypresshomecare.com. Click on the media button right below its radio show, and you'll catch this one and many more. So, Lindsay, you were talking about in the end of the first segment, all the things that the MSO really picks up for the doc, which makes a lot of sense. And I was saying, it's hard for you to manage your cash flow and do your banking and do your budgeting and manage HR and stay in compliance with all the rules and regulations and still be a really good doctor. So the concept behind this makes so much sense. So the MSO, like Cardio Management Services, comes in and you take over all of that for the physician, so the physician can spend time with the patient.
Yes.
Because that's where it needs to be.
Yes.
And that's where healthcare needs to be.
Yeah. Yeah. I think, that is something that we excel at, right? We've assembled a team of incredible leaders, and I'm grateful to be a part of that team. And I think we bring a lot of experience from all different backgrounds to really be able to focus on those things to make those practices, efficient in how they deliver their care, and then also really focusing on implementing what is best practice. Making sure that you're sticking to those guidelines and guideline-driven care, and helping to manage that from alongside the providers, giving them the tools that they need to have guideline-driven care,
Right.
and have the capacity to do the appropriate testing, to manage their patients, giving them the tools and the programs that they need. Whether it's, are they going to do remote patient monitoring? Are they going to do chronic care management with their patients? We work with specific vendors to make sure that we have all those tools in place and set up so that it works well. In turn, right, we're able to make sure that it's cost effective too. Because I think sometimes, physicians, and I love my physician partners, but a lot of times they think that they're getting the best deal, and they may not be getting that best deal. And so whether it's, your EMR or your phone system, just all of those things, coupled into those things will chip away at your expenses, and then they can get out of control very quickly, to where you're not able to manage it and not able to manage all those things, and it's just taking away that time. So trusting us with their practice is something that I think is important, but we can put things in place where we're making sure your patients aren't falling through the cracks. You have a phone system that isn't being answered 59-75% of the time. we can help you with those things to make sure that you're doing that. Your accounting, right? You're on, cash accounting or those things. A lot of things can fall through the cracks there. You're not sure what you're really doing. Helping you budget and manage things appropriately is how, we can help those providers. And then it's working with payers, making sure your contracts are good. Are you getting, your best rates for that? But are you enrolled on the appropriate payer contracts? Are you missing out in your service area is there a new payer that's come in that has a lot of lives allocated to them that you might be missing out on those patients? So we have things in place, right? The other thing is revenue cycle, right? Your billing, are you sure you're collecting? Are you sure that you're getting what you're supposed to be doing? And making sure that it's all a good cycle of care for them, which in turn creates a really good experience for your patients. And that's, I think, the most important part.
100%. I mean, you talk about payers, so our listeners can understand what payers are. What Lindsay's referring to is what insurance companies are they contracted with? So, is it Aetna, Cigna, United, and maybe there's a void in the Blues or some of the others out there. The MSO brings this to them and can help them get signed up with those payer sources. And let's face it, these payer sources, these managed care organizations, they try to cram down their rates to every provider there is. But when you have a group like yours, Cardio Management Services, where you are managing multiple practices, I would imagine that puts you at the table where you can negotiate better rates.
Yeah.
And better than the doctor could have done on their own,
mm-hmm.
which is what you get with this type of practice. And you mentioned, remote patient monitoring. You mentioned a bunch of other those things. I envision that innovation is really a big part of what you're bringing to the table too. So, one of the things that we realize is that we are in a time right now in 2024 where things are innovating so fast. I mean, we are at warp speed. Mm-hmm. I mean, since COVID, what has happened to the healthcare field has been nothing short of phenomenal. We've turned it on its head because healthcare was always slow to adopt technology. Let's just take, for example, telehealth visits.
Yes.
The number was like in the low 20% in terms of physician practices that were doing telehealth.
Well, because it wasn't a reimbursable piece.
Well, right? It was reimbursable, but it was partial.
Yeah.
They weren't given full reimbursement.
Yes.
Because of COVID, they gave full reimbursement, and all of a sudden, now we're north of 70, and we might even be in the 80% percentile range. And I mean, take cardiology, for example, right? My mother was on Coumadin for a very long time, mm-hmm. but she used to have to come in to have labs drawn. She used to have to come in to, get checked on. Now you can have labs delivered to your home. Mm-hmm. You can have those labs drawn at your home, and you can do a telehealth visit with your doctor and don't have to get in your car, sit in a waiting room, sit in an exam room, and do that with the innovation that we have today.
I think that why that's important, especially in cardiovascular, right, is, a lot of these patients, the average age of a typical cardiovascular patient is not 40, right? It's much older, and some of those patients, it's hard for them to travel. It's hard for them to do those things. And so offering a really comprehensive telehealth platform and structure is important in being successful as you deliver care to your patients. So
100%.
Yeah.
And that's what you get when you have this type of partnership and certainly embracing innovation and certainly adding these elements to a practice. What it does is it improves the delivery of care to the consumer. And at the end of the day, that's what we want.
Exactly. That's the goal, is to have a good experience for your patients, have a good, that they feel like their needs are being met and that we're not missing anything in there. So you're making sure that there is no gaps in the care, in the delivery, in the follow through, in the process and things like that, that sometimes, physicians it's hard for them, and it's gotten even harder with labor cost, for them to keep up with that and to keep people engaged and involved. So I think that's been a big challenge. I think along with as we kind of move into these next few years, you see those things about the shortage in cardiologists, right? There's a big issue with cardiologists aging out of care, and there's not enough to back up, which means that these cardiologists are expensive to find. And so that's a big issue that a lot of these practices are facing, is that they can't afford to employ another doctor in their group at this point. And so I think figuring out how you can make your practice more efficient and, give you the ability to expand your practice is important for long-term sustainability in a practice.
You made a statement early on talking about your average patient isn't in their 40s when it comes to going into a waiting room. They're much older. We have a shortage for cardiologists. I've said it here on this show, 65-year-old population between now and 2050, that's in 25 years, is going to double. Mm-hmm. The 85-year-old population is going to nearly quadruple. So the demand is going to be exponential, and we don't have enough cardiologists. Mm-mm. I don't expect you to give me the answer here today, but we got to solve for that. That's a big problem. And the MSO can't see a patient. It's a doctor that needs to see the patient. Yeah. So the MSO is trying to take all those repetitive tasks, redundancy, all those things that really don't add value to the consumer directly, but more to the practice and making them better at what they do, more efficient at what they do, and saving money in what they do. But we've got to figure this thing out.
Yeah, I think it's going to be a big issue here. Here you'll see
the tsunami's here.
Yeah, you can see it out in the distance at this point. So
you can. Scary.
Yeah.
It really is. So we have a whole nother half, and I want to talk about screening and the importance of screening. I want to talk about some of the innovations that are happening with cardiology. I mean, hearts are still the number one cause of death, and we got to do better than that. So Lindsay Thompson, stick around for the second half. We got you in the house. We got a robust show. We'll be right back. Halftime. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. We're in our second half here if you're just tuning in. I've got Lindsay Thompson here in the studio with me. She's the Vice President of Operations for Cardio Management Services. They are a management service organization funded through private equity. And in the first segment, we talked a lot about that. In the second segment, we really talked about what does a management service organization do and why is it beneficial to a cardiology practice. It's amazing, Lindsay, just all the stuff that is really more of a nuance to a doctor you take out of their hands and you let them be the doctor, which makes a lot of sense. But the scary part is how we ended that first half, and that is the fact that we are short on cardiologists, and many of them are retiring out, and we don't have enough coming through. And, hearts are still the number one cause of death.
Yeah.
And we have an aging population, and what coincides with aging populations is bad hearts.
Yeah.
So I don't expect to figure it out today, but certainly that is the biggest conundrum challenge that we have as a medical profession, as a society as well.
Yeah, I think a lot, there's part of it is creating that, efficiency in the day-to-day, right? How can you maximize their efforts so they can see the most patients? And I think that's where some of the work that I do comes in and, offload some of that. But I also think there's taking advantage, of technology, of, what can we do to optimize that? Is there ways to, how can they see more patients in a day, but also still utilize their time with their patient in a way that is good for that patient? I think we've seen, a lot of the advanced practice people coming in, so a lot more PAs and a lot more nurse practitioners, and that has helped a little bit.
Sure, it has.
But, we're still in a point where we're still going to have a little bit of an issue. And I think that's concerning because, like you said, cardiovascular disease is still the number one killer. And we've got to optimize things. But I think there's a lot of around that. It's the number one killer, I think, because people don't have good access to care. They also don't, people still to this day don't know what are the things that you should look at? What are the things that you should be thinking about in your health, taking ownership of your health, and what should you know? And when should you do it, right? When should you be paying attention to those things? I think one of the things that we talked about before when we talked about women in cardiovascular was, women don't always know or think that they should be paying attention to this, right? You're ingrained to know breast cancer is the number one killer. Well, guess what? It's actually cardiovascular. It's actually hearts. And I think that women are a huge target for understanding, your care. And it's one more thing that we have to worry about, but everyone should be worrying about this. You should know what your blood pressure is. You should know what's a good blood pressure and what might be not a great blood pressure. It's when you ask someone, what is your blood pressure? What's your blood pressure, Bob? Do you know what it is?
Oh yeah, it's roughly 120 over 80. I mean, I sometimes it's 115 over 78, but and my pulse rate is usually in the high 40s. I mean, I run really low on my heart rate.
Yeah.
But the other piece, and I'm sorry to steal this from you, it's really important, is family history.
Yes.
And I have family history. I mean, I lost my mother. She passed at 66. I just lost my dad almost 2 years ago. Both had bad hearts. A lot of it was lifestyle, but still, I mean, they had bad hearts. And I'm on a low-dose statin. I've been seeing a cardiologist for about 22 years.
Yeah.
Because I have family history. And knowledge is power. You should know your family history.
Yes. I think where that is difficult is what I see in, there's a generational piece to that too, and there's a generational component that I think oftentimes people in my generation, right, you didn't talk about that with your parents. And so, or your parents weren't always forthcoming with those things. You didn't know that your dad was on blood pressure medicine, or you didn't know that your grandfather died of a stroke, or maybe you didn't actually know your grandparents at all, because that is very common now with people my age, is they didn't know their grandparents. They weren't involved. They weren't around, or by the time that they remember anything about their grandparent, they were already so kind of old and really in poor health that you didn't know what was the root cause of some of those issues.
Right.
And so I think those are big pieces of knowing your family history, knowing what your blood pressure is, knowing what's normal and what's not normal, because actually the guidelines changed about 5 or 6 years ago on what's a normal blood pressure. And everyone always thinks, well, my blood pressure is 125 over 90 or 130 over 90. Guess what? You actually are, you're hypertensive now.
Right.
That is considered elevated blood pressure. 130 over 90 is considered high blood pressure now.
Wow.
And then anything over 140 for your systolic and diastolic over 90 is stage 2 high blood pressure. So I think a lot of people don't know that. Even people, I think, in your generation, my parents' age and above, they think still, oh, it's like 130 over 90. It's fine. It's not a big deal. It's consistently that. They forget, right, that the guidelines are different there. They should probably be seeing a physician about that. And then looking at your glucose, blood sugar is important. And that part's important because...
Your A1C.
A1C.
Yeah, you bet.
And diabetes is a big problem now, and then also your BMI, your weight. What's a healthy weight? What's a healthy BMI? Understanding those two factors together, because there's a lot we can talk about in the next segment. There's a lot of tools out there now for patients to manage a lot of these things that are really actually it's a different time right now in those things. But people don't know their cholesterol, or they've never had their cholesterol drawn. Those are things that you should be managing, or you should be looking at once a year. If you have family history, you should probably have a physical starting in by the time you're 30, you should be having a yearly physical to keep an eye on those things. Those are the things that will be the first indicators that you've got an issue.
Right.
But the other piece too, and we've talked about this, is when something doesn't feel right, you need to go have it checked out. It's better to be safe than sorry.
100%. And, A1C is something that people really don't think about. And I can't begin to tell you, even with my children, mine are young adults now. My oldest is 32 years old. And I remember she had a physical a year ago. And I've said, what's your A1C? She goes, it's not on here. And I'm like, well, next time you draw blood, tell me you want your A1C. She goes, why would I want that? And I said, well, your grandfather had adult onset diabetes. I'm in the pre-diabetic range, but I watch it and stay on top of it. You need to know what your numbers are. And I think at the end of the day, Lindsay, you, meaning the consumer, need to be in charge of your health care.
You have to. There's way too many things going on. There's too many things for your physician, or you're not seeing your doctor when you're supposed to. I think what we saw in COVID, right, and why there's a big push now for your knowing your numbers, why the screening part is so important, is because I think people got really good at going to the doctor, and then COVID happened, and you hit the nail on the head. It turned things upside down, good, bad, or indifferent. But I think what you see a lot now is there's a lot of distrust in physicians. People don't want to go to the doctor. They don't want to know these things. But the things that I'm talking about are tried, true, and tested for hundreds of years, right? It's very clear, scientific backed data on multiple levels, multiple platforms. And I think that is the key piece of this. There are so many more younger people having issues, healthy people, or what they think they are healthy, and they're having major issues. I've been following this guy in Gilbert. He super healthy, super fit guy, had a massive heart attack, and he just received a heart transplant from Mayo. He's been going through it. I got sucked in, you get stuck in the depth of social media. And I found them when I was doing some stuff with the AJ here in Phoenix. I came across them. Someone had reposted about him. And it's been very fascinating, but it's you see, he just had a heart transplant. I think his wife posted an update today, 17 days ago, and he's home with his family today. But it's so crazy that a 30-something-year-old man had to have a heart transplant.
My question, did he have family history?
I don't know that, but it would be interesting to know.
It would really be interesting to know. Got a little Coldplay playing, Lindsay.
I hear that.
I love these guys. And you know what? I hope they go back on tour. And Lindsay, it's hard to believe these segments go by so fast. And in this last segment, I really want to talk about new therapies. I want to talk about that Ozempic.
Everyone's favorite too.
Yeah, I want to know what's going on and how that is affecting cardiology, but also other places in the medical continuum. Yeah. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. Down 3 segments, 1 more to go. Lindsay Thompson's in the house. Stick around. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're in our 4th segment here. If you're just tuning in, I've got Lindsay Thompson here in the studio with me. She's the Vice President of Operations for Cardio Management Services. They are a management service organization that is backed by private equity, focusing specifically on cardiology. She is a wealth of knowledge, having 22 years experience over at Honor Health in cardiology. Been a repeat guest here. The first 3 segments were outstanding. And if you want to hear them, go out to our website at cypresshomecare.com. Click on media button. You'll catch this show and you'll catch many, many more. So I gave a little tease here for this last segment. And I think this is a good one to really, for us to really approach and tackle. And that is these new therapies. And I threw out the theme song, Ozempic. And, these drugs, I forget what they're called.
GLP-1s.
Mm-hmm. They are not new. My dad, who I shared with you guys in that last segment, he had adult onset diabetes, and he was taking Ozempic for his diabetes. Drug's been around for about 18 years. And just like they did with Viagra, which was a drug that they were working with in cardiology.
Yes.
And found out it had this side effect that, people would enjoy, and they have for years. Same thing with Ozempic. They found out people were dropping weight. So would love for you to tell us a little bit about what you foresee with this. Certainly some of the science and data, but I also would like to hear from Lindsay Thompson where you see this thing going.
Yeah. So I think, this is a time where it's an interesting, I always say, what a time to be alive, right?
Right.
It is. In this piece, this came out, gosh, when did they come out with that study? It was probably this time last year when these manufacturers had long-term data studies coming out where they had studied not only, the benefits in reducing your insulin issues, but also managing diabetes, but then looking at weight and improving your cardiovascular health. What they came to find was that these drugs are able to reduce your risk of a cardiovascular event. And then I think decoding what that means, right? So what that means is it had marked reduced incidence of events for patients who had a heart attack, stroke, or other cardiovascular related event. It also was proven to reduce their weight and help them manage their blood sugars appropriately. We've never had a drug come out and show that it can reduce your risk of cardiovascular, of not only having one, but developing cardiovascular risk factors. So I think that is the big thing here of this is a crazy time, right, in this, but it has all these benefits. Now, a year later, after the studies come out, now it's really kicked into high gear that you see the flip side of it, right? You see every single person is either outrightly open about it, or people are secretly taking it. And then people have come out and said, oh, all of Hollywood's been doing this for years, or they're all starting to take it now. My opinion on it, I think that if there is something out there that can, in a much quicker and safe way, give someone a chance at having a healthier lifestyle that would reduce their dependence or risk factors on having issues like high blood pressure, high sugar, things that would require them to see physicians more or have more issues along the way these issues are major issues that it helps improve, right? These issues land patients in the hospital very frequently. So part of some of these studies were actually you see people write papers around what's happened to the cost of care for these patients and cost of lives, and it's markedly improved that. And I think that's where I feel like, personally, if someone is overweight, morbidly obese, or even probably just a little overweight, let them have it. Give it to them and let them get on their merry way. It is their responsibility to, after they're done taking it, because you get to a certain point, right? If you don't have diabetes or other reasons of taking that drug outside of you solved your weight problem, you don't need to take it anymore. So it's getting them to a goal. It may be a short-term solution for a long-term improvement.
Well, we hope they stay on it. You and I talked about it at the break, and first of all, it's a receptor drug, which is really interesting because it turns off this receptor in your brain that tells you that you're really hungry, right? And I'm dumbing it down. So
but that's good for people to understand that.
Yeah, so so I know people that are on it, and they'll tell me that they can, they'll order a meal now. They'll share meals with their wives or their husbands, or they'll drink a glass of water and they're full. I mean, their body says that they're full. So it's important for you to get the proper nutrition. Make sure you're eating the right foods because you're probably going to be eating less of them.
Yeah.
So that's really, really important. But really, the positive consequences, which they are positive, is the fact that if people are taking these and they're living healthier lifestyles, there's further benefits that come from this. Now, I heard a statistic that back in the 1960s, that the population of this country the percentage of people that were obese. Can you take a stab at it? Because I'll tell you, in the 1960s, that was shared with me.
I mean, it was probably 20%.
4%.
Yeah.
4% of this population. I was told that if you can find someone that took pictures on the beach anywhere from the 1960s, you won't see someone that's obese because we weren't. Do you know what the number is today here?
Oh, God.
It's 45.
Yeah.
45, 46% of our country is obese. So the fact that we have this drug, that we can have people turn off this receptor, live better quality lives. I mean, not only are we going to save their lives and their hearts, but we're also going to avoid diabetes. We're going to eliminate or avoid the need for hip replacements, knee replacements. I made the comment about airlines are going to save money on fuel because the airline passengers are going to weigh less.
Way less, yeah.
There's so many positive things that can come from this.
Yeah. I think that when you look at alternatives to this, of what people will do, there's a lot more risk in it for those other things. When you look at if someone's morbidly obese or long-term obesity battle, the options are slim, right? Some of them are so far down that pathway that there's really some very minimal solutions, and those are like gastric bypass, gastric sleeve, those things which have a lot of risk in them for that. And I think going this route, you're giving someone, the tools, right? But here's the flip side of it is you can't just unleash the door to the candy shop like freely. I think it still needs to be managed by someone who's qualified to manage it. But I think that overall the benefits are substantially.
The genie's out of the bottle.
Yeah.
We're not talking about fen. We're talking about something that's been around for more than 18 years.
Yeah.
Nobody's grown a second head or had some really god-awful outcome because they were taking Ozempic or one of these GL1 drugs?
GLP-1.
GLP-1 drugs. We have literally like 20 seconds before we end.
Yeah.
You want to leave a lasting thought for our listeners as we close?
I think we touched on it before. We should all take charge of our own destiny in our health. And I think that's probably the most important thing you can take out of today's discussion.
Lindsay Thompson, so great to see you.
Thank you for having me.
Stay healthy, stay well, say hi to your mom, make it a great day, have a great weekend. We're going to be back here next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.